UK Cambridge Centre podcast. In this integrated cancer medicine research in focus series, I talk to various ICM members about their research and how it is supported by the vision of the Mark Foundation Institute for Integrated Cancer Medicine. MFICM research uses cutting-edge analytics to maximise the use of diverse high-volume datasets and by capturing cancer heterogeneity in time and space in patients receiving active treatment. Integrated cancer medicine aims to transform the way the world treats cancer by affecting patients along their treatment pathway and ultimately accelerate cures. Today I have with me Claire King, Sanchez and Rhys to talk about some of the amazing engagement, EDI and PPI work that we do here at the CRUK Cambridge Centre. Dr. Claire King is Programme Manager for the Cancer Immunology and Advanced Cancer Imaging Programmes, as well as an EDI champion for the CRUK Cambridge Centre. Sanchez is CRUK Senior Research Nurse and co-lead for the Nurses and Allied Health Professionals Programme at the CRUK Cambridge Centre. Dr. Rhys is the Engagement Lead and an EDI champion for the CRUK Cambridge Centre. So welcome everybody. To start with, can I please ask you to outline your roles at the Centre with regard to engagement, EDI and PPI? And if you could just tell us what each of those things mean as well while you tell us about your roles, that would be super. I'm going to start with Rhys, please.
Thanks, Ellie, and good morning. Thanks very much for having us. I think we've all probably got slightly unusual roles in this area. So it might be beneficial if I take us off on a little bit of a tangent and set the scene first, just so that we can help the listeners understand what engagement actually is, because it's one of those terms I think we often hear, but we never really sit down and think, okay, what does engagement actually mean? What is it we're trying to achieve and why is this work important? So in the UK, we have an organisation called the National Coordinating Centre for Public Engagement, or the NCCPE. And as you can probably guess from their name, they coordinate public engagement on a national scale, providing resources and frameworks of best practice for higher education and research institutions to use. Now, they define engagement as being the myriad of all the different ways that the activities and the benefits of higher education and research can be shared with the public. And that is by definition a two-way process that involves interaction and listening to the public with the goal of generating mutual benefits. So if we think about that, it covers the full myriad, all the different ways we could possibly share our work with the public. That effectively means that anything we do with external audiences is a part of engagement. So it's a very big, diverse, broad field. And to make sense of that, I have a model that we're using in the CRUK Cambridge Centre that we call the engagement spectrum. So if you imagine a scale, on the left-hand side of the scale, you've got lots of interactions with very large numbers of people. We're interacting with millions of people in one go. But these interactions are passive. They're highly transient. They're very unidirectional. They're very fleeting. At the other end of the scale, on the right-hand side, you've got really active, bidirectional, deep interactions, strong, permanent working relationships. But these are only with a smaller number of people, just a few public representatives. So the scale runs from millions of people down to tens of people, but inversely, it's transient interactions down to super strong, permanent working relationships. So the engagement spectrum, all these different ways that we can work with the public, really it starts with traditional communications methods, moves through to digital communications methods, then traditional public engagement, then what we call widening participation and outreach. Then at the bidirectional end, we have patient and public involvement, where members of the public actually help shape research studies. And all of this is underpinned by our commitment to equality, diversity, and inclusion. So traditionally, you'd have your communications team over there, and your public engagement team might be in another building. Your equality, diversity and inclusion team might be another separate group of people somewhere else. And traditionally, they don't really talk to each other. So my role in the CRUK Cambridge Centre is to break down those silos and to connect these normally separated workflows into a single coherent portfolio of work to make sure that all of our engagement staff are working together and working towards the same goals. So it's not necessarily a standard role, it's a broad role, it's a very exciting role.
Thanks, Rhys, and thanks for setting the context. That's really helpful. Claire, do you want to outline what your role is in this engagement, what should we say, melting pot?
Thank you, and thank you for inviting me on today. It's really exciting to be here. My role is to work alongside Rhys in co-leading the EDI committee for the centre. What that means in practice is that we carry out a variety of tasks, including managing the centre's committee, which is quite a large number of people. We work together to design and develop the strategy that we're going to use as part of the centre's EDI work. We represent the EDI committee at the exec meetings, science advisory boards, and we also get the privilege of writing the reports as well to go to Central Cancer Research UK and other funding bodies about the things that we do to encourage and promote EDI within our centre's work.
Fantastic. And just for our listeners, EDI stands for?
So EDI is equality, diversity and inclusion.
How would you define EDI in the context of the work that we do here at the centre?
Perhaps it's easier to answer the question about what EDI means in the centre if I look at it from a different angle. Cancer is non-discriminatory. The current stats show that 1 in every 2 people will be affected by cancer in their lifetime. That's irrespective of your age, your race, your colour, sexual orientation, or any other characteristic. While there are certain tendencies towards specific cancer types within different population groups, cancer is still cancer. Receiving a cancer diagnosis is still devastating, whoever you are. Those of us who work at Cancer Research UK in whatever role do so because we want to see an end to this disease. They might be motivated by 1 or 2 individuals in their life, but ultimately we do what we do because we want to make a change, the better for everybody. I think, therefore, EDI must be at the heart of everything we do at the centre. And in order to do fully inclusive research, we have to be a fully inclusive workforce. We also have to engage with a truly diverse population. And we must make sure that we equally represent everybody who we are fighting to save in the work that we do.
Thank you very much. And Cherry, tell us where you fit into this picture.
Yes, so thank you, Ellie. I think my role is very unique. I'm wearing 3 different hats in the centre. So one is the CRUK Senior Research Nurse and the lead for the Nursing and Allied Health Professionals program. So one of the things that I do in this roles is engagement activities. So trying to raise awareness that research is very important, and I'm trying to improve communications of what research is and how they can involve in research, and also do some trainings, so conducting workshops, training sessions to really enhance public understanding of different specific areas of research. Aside from that, I'm also involved in the experimental cancer medicine PPI group. So that's patient and public involvement group, where I'm involved in managing a group of patients and patient representatives to develop and implement different strategies to involve them in public research projects, and also acts as liaison between researchers and public contributors to facilitate communication and collaboration between the two, and ensure that there's adequate, diverse and inclusive recruitment and supporting public contributors as well.
Fantastic. I mean, you 3 are just the most wonderful team. So thank you for the work that you're doing. Claire, we've already defined what we see as EDI in the context of the work we do at the centre. You've already kind of alluded to that. Could you say a bit about what the centre's EDI strategy is and how you implement it?
The centre's EDI strategy is essentially made up of 3 strands of work. So the first one is looking at making sure that our Cambridge Cancer Centre is an inclusive place to work for all of our staff, our executive members and our membership who kind of fall underneath the umbrella of the centre's work packages. Within that, we aim to provide support to all of our staff and our members, including the promotion of diverse networks, race equality, disability, gender equality, and other characteristics, just make sure everybody is supported in whatever way they need to be. We try and work with the departments that make up the centre, because the centre obviously covers a number of departments across the whole of Cambridge, so it's quite a vast organisation. So we're building relationships with each of the departments and their EDI committees to make sure that we can support them in ensuring that the needs of the staff who work within that physical location are supported as well. And then we are trying to promote an inclusive community environment where collaboration in research projects, clinical and academic, work really easily. So we're trying to encourage collaboration by encouraging social networking, providing opportunities for that to happen. Our second strand is about ensuring that our research is fully inclusive, which involves activities like educating our researchers on the benefits of adding an inclusive arm into their research projects. So that includes things like adding in biological samples from a population that they may not have considered, things like in preclinical studies, using a cell line that comes from a number of different ethnic backgrounds. In translational research, making sure that actually all members of the population that we serve are covered within their study design. And then we also try and promote inclusivity in our clinical research by making sure that all of our patients benefit from that research. And so we involve as many of them as we can in kind of the study design from quite early on, and make sure that each patient population is represented within the study reach as well, which is where Cherry's work is really important. And then our final strand is about ensuring that all of our engagement work is inclusive, relevant and accessible, which is where Rhys has done some amazing work over the last few years to kind of improve that. And we're hoping that we can just take it from strength to strength. But the aim there is to broaden the public understanding of things like cancer risk, the research and treatment that's currently available, and the things that we're trying to work towards, and then developing inclusive and diverse resources so that we can make sure we're reaching out to everybody, that everybody has that same level of understanding and opportunity to participate. We are also trying to promote public and patient involvement within each of our programs and institutes, and then also trying to engage with a fully diverse public population to encourage and nurture the next generation of researchers that are coming in to work for and with us.
Brilliant. So it's just a complete umbrella of inclusivity. I love that. That's wonderful.
And it's all made possible through the committee that we established in the early part of our work. So we have a fantastic number of volunteers already who represent every role and characteristic that work under the umbrella of the Cancer Centre. And Rhys and I are eternally grateful to them because they are such an enthusiastic and fantastic group of people to work with. It's brilliant. In order to implement all of that, we are working to achieve goals that were identified through a survey that we've sent out to our centre membership, to our patient and public involvement contributors, and found out what mattered most to them. And we've used that data to identify the several goals that we're trying to work towards achieving within our first year. And then we'll repeat that process and just make sure that each time we're hearing the voice of the people that we serve and making sure that we meet the needs that they have.
Fantastic. So I know that we all participate in many engagement activities here at the Centre, not least of all the Cambridge Festival, which I think all of us were volunteering at a few weeks ago. Rhys, I wonder if you can give me a summary of all the different types of engagement that we do. I mean, I know that we do lots and lots, so a brief summary would be great. Otherwise, we might be here all week.
Yeah, I was a bit worried when you just said the word all, because there's a lot. As we've just seen from my run through of the engagement spectrum earlier, it's a very, very broad field of work engagement. So I'll just try and give you a whistle-stop tour the whole way through the spectrum of the type of projects that we do and that others in the cancer research community do as well. If we start with the left-hand side of the engagement spectrum, so we've got these transient interactions, but with high numbers of people, hopefully in the millions. This is where our traditional communications methods fit. So things like press and media coverage, news reports, print publications like newspapers, newsletters, branding, and so on and so on. This is something that we've been doing for a very long time, right since the inception of our centre, actually. And we're really good at this, I have to say. So, for example, in the last funding period from 2017 to 2022, we had over 22,000 news stories written about cancer research from Cambridge in over 2,000 news outlets in almost 100 countries. So we are really good at our traditional communications work, and that's led by Katie Edwards, our fantastic communications manager. If we take a step across the engagement spectrum, we then come to what we would call digital communications and digital media, or sometimes this is referred to as new media. So this will include websites, social media, also resources like videos, this podcast, infographics, blogs, and so on. These are really useful techniques because we're able to share information about our research with the public on a global scale, but we can also begin to start getting some bi-directional interactions through comments, replies, likes, shares, and so on. So we can put our information out into the public domain, but we start to see which aspects of our work the public understand, what they're most interested in, where our priorities should lie, and so on. So we can start adapting to the feedback the public give us. If we take another step across the spectrum, we then get to what we refer to as traditional public engagement. So now we're not just disseminating our work out to the public, we're not just sharing information. Here we're actually trying to have a discussion. We want to talk to people to raise their interest in science. We want to inspire the next generation to have careers in science. And we also want to build public trust in scientists and in researchers. So this type of work includes things like public lectures and webinars. Some of the listeners may have seen our Ask Me Anything podcast episodes that are recordings of our public webinars. We also do things like open days, so experimental cancer medicine demystified, that Cherry's heavily involved in with the experimental cancer medicine patient group. And Ellie, as you've mentioned, we do things like science festivals, so the Cambridge Festival, where we're running hands-on activities and demonstrations. If we take another step across the spectrum, we are getting there, we're nearly at the end. We then get to the point where the relationship, the interactions are becoming stronger, they're lasting for a longer period of time, they're deeper interactions. And this is what we would refer to as widening participation or outreach. And I think Cherry is going to give some examples of some of our work in this area in a bit. But I will say this includes things like community events, science enrichment days, workshops, work experience placements, work with schools, and so on. So just as an example, we recently ran a science enrichment day at a local primary school.
I just wanted to say that was my children's primary school, and it was completely fantastic. And we had 180 children engaged in all sorts of hands-on science, and they had a whale of a time and actually talked about it for weeks and weeks afterwards, particularly the VR headset. So that one was a complete hit. Sorry to interrupt.
No, that's all right. I mean, you haven't actually pointed out, Ellie, that you're also heavily involved in our engagement team in the CRUK Cambridge Centre, producing this podcast and contributing hugely to a lot of our hands-on events and our schools outreach. So that's also worth a mention.
It's a passion of mine too.
Just whilst we're talking about sort of widening participation and outreach, actually, I would also put educational resources and lifelong learning into this packet of work as well, because part of our goal is that we want to enable anyone to pursue an interest in science, not only those who are in formal education. So even adults are within this remit. And a nice example of this is last year we launched a shared risk e-learning course that's available on our website, and shameless plug, there's a podcast episode on that as well. The aim of this was to teach people and help them understand what risk is in the context of cancer, but from the viewpoints of different disciplines. Then if we take our final step now to the right-hand side of the engagement spectrum, we're now in the area where we have these truly bi-directional interactions. They're very strong, they're permanent, they're deep, but by their nature, we can only have that kind of relationship with tens of people. So here, we're not just disseminating our work, we're not just discussing our work, we're actually involving the public in the doing. We're actually genuinely sharing the workload with patients and members of the public. So we'll collaborate with them and we'll have them join our research teams to make our research better. And this includes things like some consultative projects. There's a lot of work going on in our centre looking at the use of artificial intelligence in the diagnosis of ovarian cancer, for example. And we're trying to understand how the public feel about having AI used in their cancer care. We also have patient representatives on our committees and working groups. We use patient and public involvement groups or PPI groups to provide input and feedback on our work. We even co-produce projects with patients. And in some cases, we actually have patients as co-applicants on the study. So they're equally as involved as the research principal investigator. And you'll hear more about that later on too. And as finally, just as Claire and I have said before, all of this work is underpinned by our commitment to equality, diversity and inclusion. So that's the engagement spectrum. There's a lot going on.
Yeah, thank you for that whistle-stop tour. There is so much going on. That was beautifully said. Well done. And Cherry, if I can come to you now. You've been the centre lead for the NAHP programme for about a year now. I think that's right, isn't it? Yeah. And in that time, I know you've initiated some fantastic engagement projects and activities. So I was wondering if you could tell us about some of them.
Definitely. It has been an amazing year for me. I'm working alongside Rhys, Claire, and everyone in the centre for different activities and projects on EDI. And I think I must say that on every EDI project that we take on, we constantly try to make it very inclusive, relevant, and accessible. And on top of my head, one of the most highlight of the year that we did last year was in October, we were invited to this Cambridge Women's Wellbeing event. And this is being hosted by the Muslim community. So we had a stand there where volunteers from different programs in the centre. So we've got the Nursing and Allied Health Professionals programme, we've got ACE Cambridge Ovarian programme, and then we've got Precision Breast Cancer Virtual Institute. So from different professions as well. So we've got nurses, doctors, clinical research practitioners, data managers, trials coordinators coming in to talk about cancer, to talk about research projects. And there was one specific time that I could never really forget about the event. And it's one of the things that the event coordinator said. So we were inside this Cambridge Central Mosque, and we were bringing this like female silicone models, and we weren't sure if it's allowed there or if we can place, or do we have to hide it a bit. But then the event coordinators just came in and said, we are breaking taboo here. It's a wonderful thing to see that female silicone model, and it should be the start of the day. And that was amazing. And the impact of the event is really beyond that. So the event, as I said, was held in the Cambridge Central Mosque. And it's really an opportunity for us to engage to this population group, to talk to our Muslim community. And in Cambridge, we have a very diverse, about 6,000 Muslim community people. And we have Bangladeshi, who makes up the majority group, about 38%. But we also have Arabic, Turkish, Nigerian, Pakistani, and Iranian groups in that community. And that's a very diverse community where we only engage with on events like this. And looking back, when you look at the event, you can see that actually, although it's a women's health event, it's actually a family event. So it's nice to see women interacting with us healthcare professionals about research about cancer, but also their husbands are joining in that conversation. And that's very wonderful to experience. They also often come with their sons and daughters as well. So thinking forward, if we try to engage with these community groups, then definitely you need to think about how can you make them all engaged. So we need to think about the women, we need to think about the husbands, we need to think about the sons, the daughters. And it's actually very much different to the Men's Health Week event that we hosted and we supported, I think, about a month later. So on the Men's Health event, this one is being sponsored by the Cambridgeshire and Peterborough Integrated Care Systems, and it's at the Cambridge Football Club. And on this event, men, they often come alone. And if they don't come alone, they often come with their sons and mostly in their teenage years. It's very different from the women's event. You barely see little kids running around like or hopping from booth to booth like the women's wellbeing event. And activities were a mix of physical activities and lectures. And there were sessions like kickboxing, mobile fitness gyms, and the like to really engage them. And I'm amazed by the extent of the interaction we received during our cancer awareness lectures as well. So Julia is one of the research fellows that I'm working with. She's from Anglia Ruskin University. And we talked about different types of cancer. So we talked about men's cancer specifically. So breast cancer, prostate cancer, and bowel cancers. And because there was a lot of media presence on prostate cancer specifically in 2022, there was a lot of spark of interest going around the room, especially about the events. And the men were actually asking questions. And the room for lectures was always full, and with men asking, very important details about what they wanted to know about these types of cancer. I think it's a highlight for me and Julia is that we have our men from the homeless population groups joined the event, and that was amazing experience. So it's a good opportunity for us to bring them back into the community and get them involved and engaged in our other programs. And this ties in well with one of the projects that I was leading or helping on. So we have this Cancerless EU project. So Cancerless EU project is one of the international projects that aims to leave no one behind in the meaningful advances in cancer care. So mid last year, we received a call for support. And by we, I mean the Cambridge CRUK Centre. We received a call of support from our colleagues in Anglia Ruskin University, where they're working on homeless population groups through Cancerless EU projects. It's a very interesting, meaningful project, and it introduces the Health Navigator model as a cost-effective and really evidence-based method to foster health outcomes of deprived and hard-to-reach groups on prevention and screening. And this time, we're focusing on the homeless population group. Now, the idea of the project is really for a health navigator to come into the different homeless shelters. So at one point, the navigator, Julie, at that time, really needed to spend time with these homeless groups, cooking meals with them, interacting with them, talking with them, really developing that trust and relationship. And definitely the health navigator would also need to reach the homeless shelter coordinators with information and skills to make it a more sustainable project. And I think if we're talking about EDI projects, one of the things that we really need to focus on is how can we sustain it moving forward? If we're not going to be there, how can we make it that the project is still visible? And for us at CRUK, for the Cancerless EU project, we're very heavily involved in delivering workshops as well. So we're talking about health and wellness, cancer prevention and risks. This is the other half of the Health Navigator model. So, and it's amazing to see how the engagement from the group has strengthened as the time goes by, as we continue on delivering these amazing workshops. So we started off with maybe 1 or 2 or 3, and until such time that we develop more engagement from the group, and it's now became a 6 to 7 in a week. And you can tell that participants are now more at the point where they're comfortable to tell us what they wanted to know and what they wanted from us. And also because I'm a nurse by profession, and so if there are any concerns from the group and they wanted to be assessed, I can do that. And I was in the position to do that for this shelter as well. And if there was anything concerning, then we definitely need to register them and refer them to the Access Surgery. So in Cambridge, we have this GP service called the Cambridge Access Surgery. So it's a specialized GP practice that really specifically caters to a group of people with no permanent home address. And we don't start from just referring. We also keep an eye on their attendance to the surgery. Did they go to their appointment? Do they need further tests? Do they need further supports? And this is really to ensure that they feel supported alongside the process. And I think that summarizes all of the major activities and projects that we had for the past year. And I can say definitely we've done really well, but I think we can still do more for the next coming years.
Terry, that is an amazing outline of some just wonderful, wonderful work that you have pioneered in this past year. So, I mean, absolute kudos to you and the team for doing that important work. I wanted to ask you, obviously we engage with people of all ages, children, students, general public. How do you think about tailoring your engagement demos for each demographic? Rhys, do you want to take that one?
Yeah, this is a really interesting question, and it's one that I get asked a lot. Basically, every time we do a new event, the researchers and the project team ask about tailoring our engagement demos. And I think the simplest answer is not the answer that you're probably going to expect me to say, and it's that we don't tailor our engagement demos, generally speaking, to each demographic. If we think the Science Enrichment Day that we did at your kids' school, Ellie, if we're doing a day like that for 10 and 11-year-olds, so year 5 and 6 in the UK, the level of scientific understanding that those children have, their level of scientific enjoyment, and even the way that they prefer to learn, be it visually, hands-on, listening to a talk or whatever, that's going to be different for every single one of those 60, 120 children. It's effectively impossible for us to tailor one activity to meet all of their needs. And similarly, the work with people experiencing homelessness that Cherry's mentioned, it's very difficult to cater for every single person's needs specifically, because everyone is at risk of becoming homeless. It doesn't matter whether you left school after your GCSEs or whether you have a PhD in astrophysics. Everyone could potentially become homeless. So that level of scientific understanding is so broad. So I say we don't really tailor our demonstrations and our activities to specific demographics. I think the best activities should be accessible to everyone, irrespective of their demographic. But that being said, there are sort of three things that I would say we do. The first of these is the concept of relax, distract, interact. And I'm borrowing that phrase from our partners in the Cambridge University Hospital's arts team, because I think that's a brilliant phrase. So cancer is obviously, it's not a pleasant topic to talk about, and it can be distressing. So we want to use our activities to make people feel comfortable, relax. We want to distract them. We want to reduce their anxieties. And we want to use them to enable an interaction, to foster open communication between the attendees, the participants in the activity, and our researchers. So relax, distract, interact is the first thing we do. The second thing is all about layers. So we want layers of involvement in our activities and our demonstrations, where the attendees can get as much or as little science from them as they want. So, for example, an activity that I'm sure most of the listeners will have seen is the DNA bracelets activity. So you have little coloured beads, 4 colours representing the DNA bases. You thread these onto some string and you make a double-stranded DNA bracelet. And we do this to teach the base pairing rules, so adenine to thymine, cytosine to guanine. You can just take part in this activity for fun. You can just it's a creative activity. You can make a bracelet, take it away and keep. You could delve in a little bit deeper. You could learn the key message we're trying to share, which is that A base pairs with T, C with G, and so on. You could go a little bit further and understand how mutations can lead to cancer. Or you could go all in and actually have really deep conversations with our researchers about tumor suppressor genes, oncogenes, and the latest cancer research. So it's all about having those layers. Then the final thing, the third thing, is that although we don't adapt and tailor the activities, we as the volunteers, the demonstrators delivering them, we do adapt. So we have to tailor our conversations to suit the specific audience. So if someone doesn't have much understanding of science, as the volunteers, we have to tailor our conversations to make the scientific fundamentals accessible. Whereas if it's someone with a PhD who has a lot of interest in science, we might be talking about our current research. Or if it's someone who has no interest in science at all, we just let them do the activity and we just speak to them, because it's still important that they get the opportunity to interact with and talk to some scientists. Probably not the answer you're expecting. We don't tailor our activities, but we do tailor our interactions and our discussions to suit the different demographics.
I actually think that's a wonderful answer to that question, because a very wise teacher once taught me that it doesn't matter what you're teaching anybody, it's how you present it. And if you present it in an accessible way with accessible language, they will always learn and take something from it. So fantastic answer. Thank you, Rhys. I want to ask why it's important to involve patients in our research projects and at what stage do we involve them. So we've already talked about that a little bit. Sometimes we involve them right from the very start, as we've said. But why? Why is it important? Can you each sum up in one sentence why you think it's important to engage patients and the public in our research?
I can actually sum it up in 2 words, or one word that's hyphenated: patient centricity. We need to put patients front and center in all of our work. They are the ultimate goal. So all of our work needs to be patient-centric. If you'd allow me 6 more words, I would throw in patient relevance, patient suitable, and patient acceptable. That's sort of sub-levels of patient centricity.
Fantastic. Claire, would you like to go next?
Yeah, I think Rhys has covered most of it, but I would say, in addition to that, having a patient voice when we're planning our studies really helps us to make sure that we are not missing something really obvious that we as scientists might consider to be okay, but actually when it comes to the context of a patient journey through their cancer treatment, for example, actually we may not have considered how that plan of action, so to speak, through the study might impact them and make them feel. So having that early on really helps us to make sure we're doing something that's relevant to them as well.
Fantastic. And Cherry, give us your top as well.
I think I can summarize it with patient and public trust. The more heavily involved they are in research and engaged in different activities, the more they understand about what we do, why we're doing it, and they can get their voices out there as well to diversify our perspective as researchers.
Fantastic, thank you. How do we contact the more difficult to reach demographics of society to get them involved with research and also comfortable, as Cherry says, in engaging with testing, etc.? Cherry, do you want to give me your thoughts on that one?
I think this is very particular, really interesting question, Ellie, and I think is a priority not just for the Cambridge Centre, but all across the UK. And from conversations and experiences that we have, there are still different opportunities for us to develop strategies on this strand. And currently, it's actually at the Centre's EDI strategy to really ensure that our research is fully inclusive. But if I'm asked, I would say that one, we need to develop links with different groups, especially those of difficult to reach demographics. And we know that the Cancerless EU project worked because the health navigators and health professionals like me immersed ourselves into the group. We spend time with them. We find interest and actually listen to them, what they need and what they have to say. And that points to our next step of how we engage with them. So we need to understand them. We need to understand that their current level of awareness of health, well-being, cancer, prevention risks, and different treatments. And only then do we understand the barriers of why are they not participating into research, or why are they even participating into research, their previous experiences as well. And together that can form our awareness of their needs. And every group has different needs. So Winter Comfort, for example, when we went there, the group would definitely benefit from information sharing and discussion and different diverse activities that can help them engage, especially, different women's sessions that we've been to. But when we went to Emmaus community group, it's not the case. Emmaus have a really strong network of support already in place. And they said that this approach does not work for them. So this is just one good, interesting example of how different can it be for different groups. And in summary, we need to understand them, understand the structure, understand their needs, and we act on them. If we address these barriers, then definitely we're hoping that we have much better attitude on conversations about research, and particularly about engagement, about studies that we do here in the Cancer Centre.
Thanks, Cherry. Rhys, did you want to add something?
Yeah, I completely agree with Cherry. It's really important that we reach all demographics of society. But I think it's also important that this doesn't become tokenistic or a box-ticking exercise. We really don't want the groups that we're engaging with to start feeling like a commodity, because you can imagine that as more and more organizations realize the benefit of representative engagement, these same community groups and the same community networks are going to be contacted over and over and over again. And that's really not what we want. So in the CRUK Cambridge Centre and the University of Cambridge, we work extremely closely with Cambridge University Hospitals, NHS Foundation Trust, and the Cambridge Cancer Research Hospital Project, so that we're jointly engaging the underrepresented, hard to reach, and seldom heard from groups. So rather than having 20 plus different departments all reaching out to them, we're one united team, all working to improve cancer research and cancer care service delivery across Cambridge.
Yeah, I can see that's really vitally important, isn't it? And Claire, I wonder if I can ask you, how do we ensure that our very busy researchers and professional staff at the Centre engage with EDI and make it an inclusive place to work?
That's a great question. Having spent a number of years working in research myself, I am fully aware of how busy our researchers actually are doing the research. And certainly as you progress to those more senior levels of career, your time just flies, really. At the same time, I'm very aware also how driven and excited by data those scientists quite often are. So I think one of the first steps in engaging to them is presenting to them in very easy to digest, almost bite-sized chunks, the reason that you need to engage with EDI. So, for example, giving them the stats to say that a deaf person may be more likely to be diagnosed with cancer in a late stage because they don't have the ability to explain their symptoms or to understand what the symptoms mean when it comes to their healthcare. Explaining those things, putting those facts across actually gets them excited in the first place. And that was one of, I think, the drivers that kind of made me more passionate about EDI as a researcher myself. I think the other element is that historically EDI has been presented as a very dry subject. It has almost been that box-ticking exercise that Rhys referred to earlier, where they simply work through a quite dull training course online and tick a box at the end to say they've completed it. So one of the projects that we're working on in the committee is to develop a toolbox of engaging activities that demonstrate the importance of EDI in research. And that's, as Rhys also said, when we take those engagement activities for About Our Science out to schools, when you get somebody actually doing an engaging activity, you also have that opportunity to talk to them and answer their specific questions about it and their concerns about it. And so you aim to have a very similar process for engaging researchers in the EDI. The final complication is, as I alluded to earlier, the Cancer Centre covers departments across the whole of Cambridge, which, although geographically is not huge, it's big enough to make it very difficult to reach out to everybody in a single session. And so one of the other things that we're working on is developing a kind of roadshow where we can take those activities, those lifelong learning courses, out to all of the departments and reach as many of our staff members as possible. In terms of making it an inclusive place to work, that comes back to building relationships, which actually kind of also answers a bit of the question that you asked previously, is that working with those other departments like CUH, the CCRH project, working with the EDI representatives in those departments, we can actually make sure that they are fully supported in making sure that any staff members they have with needs like disabilities or with preparing for having somebody come and start working with them who needs special access to higher floors and they don't have working lifts, and are there ways that we as a centre can support them in making sure those departments are actually meeting the needs of the staff members who work for them. And some of that I'd like to do almost proactively in saying, are you fully prepared for having a member of staff come and work for you who is deaf, for example, and can't hear a sounding fire alarm or an audio only alert to a lecture starting? There needs to be a more inclusive way of preparing for somebody like that. And by doing that, we're actually inviting those people to come and work for us because they understand that we are aware of what they need in advance. I hope that answers the question.
Yeah, that's fantastic. And I'm so happy that it's in your hands to be thinking about this. This is wonderful. I'm going to ask you one last question. Claire, you've sort of already told us the answer for EDI, which is, where do you see the centre's engagement in EDI, PPI activity taking us in the next 5 years or so? So, Cherry, if I could come to you to give us your thoughts on that, and then final word to Rhys.
I think the conversation on EDI and patient and public involvement perspective in research is here to stay. I hope that in 5 years, we will make progress in how we can leverage and maximize the different talents, expertise, and knowledge that we have across the centre, our PPI members and the volunteers, and to make it a much more inclusive, diverse, and really equitable research. And we hope that the PPI group will be more involved in co-design and delivery of research as well. And as we all said, it's not just going to be a tick box exercise. Hopefully the involvement is not at the very end of the planning process, but actually at the start of the planning. And we hope that our diverse community groups would be immersed into these activities and find a community through involvement in maybe some of our PPI groups at some point. And, there are a lot of things that we need still to do before we reach that stage. However, having this platform today would be really a good opportunity for us to share our work, our progress, and our aspirations. And it's a great opportunity to start the conversation in EDI. And I think that is very important.
Thanks, Cherry. Final word, Rhys.
I think I'd like to see it taking us somewhere where the whole engagement spectrum is far more embedded in our research culture, so much so that it becomes like a second nature. So for our researchers, it would be as soon as they publish a new journal paper, they immediately write a lay summary that gets published on their website so that the science is accessible and can be understood by the public. A situation where every year, every research group is taking part in a science festival like the Cambridge Festival to get the public hands-on with their science, and getting to a point where principal investigators and the group leaders routinely allow their group members time away from the bench to go and do outreach, widening participation, engagement work. Also, obviously, patient involvement right from the start, right from that blank paper stage in a research project, because ultimately, better engagement of patients and the public that's representative of the full diversity of the population, that leads to better patient and public involvement in research, which in turn leads to better patient centricity of our research. So that's better research, and we're progressing our mission of ending death and disease caused by cancer. That's what I'd like to see. I think we're definitely improving. Hopefully our persistence will pay off.
It just remains for me to say thank you so much to all three of you for a really wonderful conversation and for all of your work. Long may it continue. Thank you very much.
Thanks very much for having us.
Thank you so much, Ellie.
If you want to find out more about the work of the Mark Foundation Institute for Integrated Cancer Medicine, please visit our website at www.integratedcancermedicine.org, where you can find details of the ICM vision, all the current research, clinical trials, resources, publications, and team information. You can keep up to date with our latest news and events, and you can also sign up for our newsletter. If you would like more information about the work of the CRUK Cambridge Centre, please go to www.crukcambridgecentre.org.uk, or you can connect with us on Twitter using our handle @CRUK Cam Centre. Thanks for listening, and do join us again soon.